Welcome to the question or responses for the video Bone on Bone. Now, please like this video, share this video, and subscribe to our channel. It's going to help our channel grow and to spread this vital, world-changing, life-saving information. Now, let's get into the questions. Oh, epic quote from Margot. The physician should not treat the disease, but the patient who is suffering from it. Maimonides. Brilliant. And this is why I teach our doctors to not diagnose. Okay. So, and think of this. If you have 10 people with fibromyalgia, 10 people with arthritis, 10 people with bowel disorders, do they have the same physical, chemical, emotional stressors? No. Chiropractic, Ayurvedic, acupuncture, all of these ancient healing arts, thousands of years old, none of them diagnose a disease. They all treat each person as an individual. That is the key. But now the medical therapies are so dangerous that if the person gets harmed from the treatment, well, the doctor did the right therapies for the diagnosis. No, treat the individual. Brilliant quote. Brilliant quote. Okay, question 1 from Tony Molina. Do you recommend any location or chiropractor in the Phoenix, Arizona area? The best thing to do is to use our 7 questions. And they're really, really basic. Like, number 1, do you take an x-ray? Okay, fantastic. That's a good start. Do you take a second x-ray to document that you actually fixed the problems you found on the first x-ray? That's next level stuff. And then does the chiropractor work on post-surgery patients? If they're doing pre and post x-rays, they're going to see the arthritic changes in the spine. They're literally going to be showing reversal of arthritis. So that's another question. Do you work on kids and seniors? So that, again, is a skill level. They only got to answer yes to 5 of the 7 questions, and then you got a good chance of finding a good chiropractor. And it doesn't mean that if a doctor is doing an objective analysis with nerve scans, x-rays, live blood cell analysis, or whatever objective analysis they're doing, that those chiropractors are good, and chiropractors that are just working with touch and feel are not good. That's not what I want to communicate. It's just one is doing, it's like an orthodontist versus a dentist. Okay, the orthodontist, you go if you have a real problem that you want to get corrected. The other one will give you a good cleaning. And use our 7 questions and let me know when you find one. Question 2 from Trudy Taylor and from DFJU. Does light rebounding help? Absolutely. Doc, what do you say about rebounding for 15 minutes every day? Incredible. Incredible. Rebounding, and you figure when you're bouncing, you're going on a negative pressure and positive pressure. Negative pressure and that positive pressure is going to be, straining all of the bones. It's going to be straining the ligaments, and then the negative pressure. So you get this activity of moving lymph, because lymph, you've got 4 times the amount of lymph as you do blood, and lymph gets its movement or flow through movement. So that's going to be ideal. It helps with brain function. It helps to stimulate bone production. It's incredible. I totally recommend the rebounder. That's why we have rebounders at 2 of my 3 clinics. I put it in the other one, but we just don't have the room for it. But we do recommend it to everyone. Excellent question. Question 3 from Bank Pool Artist. Sounds too good to be true, especially if you have spinal stenosis, herniated disc, scoliosis, sciatica, etc., etc. Okay, it does sound too good to be true, but let's break it down. What's spinal stenosis? Stenosis just means narrowing. So normally you have a beautiful curve in the neck. If you have loss of curve forward head carriage, that creates stenosis. So how do you correct spinal stenosis? You restore the natural curves. And discs get their nutrients through movement. And discs have a horrible blood supply. So if there has been a past trauma, then the disc doesn't get its nutrients and it starts to get compressed. And so that herniated discs are alive. Same thing, that has to do with the trauma, and it's not necessarily where the pain is. So this is why on sciatica, we have to look at the entire structure. You have to look at the pelvis, the lumbar, because the sciatic nerve has 5 different origins out of the lumbar and sacral area. And so if you have an alternate movement, so we look at people's feet, at knees, at hips, at pelvis to stabilize the pelvis, you have to look at the entire structure. Because try this experiment. Sit up nice and straight, slide your shoulders off to the side, not by tilting, but by keeping them level, and just hang out there. Where do you feel it? Well, in the low back. So if you have a thoracic deviation, you're going to change the force loading on the low back. And that's going to change the nutrients to that and also change its position, motion, and communication with the brain. So all of this stuff, herniated discs, we show discs regenerated. Stenosis, you can show stenosis corrected on a pre and post x-ray. Sciatica, okay, every human being has 2 sciatic nerves. And that means that there is some type of nerve compression in the lumbar or sacral area. So identify that through static and stress x-rays and then correct it. And I got to tell you, when we go in there and we see degeneration in the neck or low back or mid back, and we take a bending film to one side and a bending film to the other, if there's movement at that joint, then that joint can regenerate. It is too good to be true because you are in the sickest society the world's ever seen. And the majority of doctors now are treating sciatica, herniated discs, and herniated discs are misdiagnosed all the time because you're going to get that diagnosis of a herniated disc laying down on a plate while a magnet spins around you. It's called an MRI. And that changes because you've got gravity pulling down and the table pushing up. So it's going to distort images. This is why they went from a horizontal MRI to a vertical MRI because it was giving a lot of false positives. And a disc herniated can go back to being a normal, healthy disc. You just got to create inflammation at the level of the disc, restore, change the position and motion so that disc can get its nutrients. And what's the number one drug that is used to treat the discomfort from spinal stenosis, herniated disc, scoliosis, sciatica? What's the number one drug? It's going to be a non-steroidal anti-inflammatory. And this destroys the building block of cartilage, the proteoglycan production. So every Advil, Motrin, Aleve, all of those things. This is why doctors, they want their patient to be comfortable, but they're not aware of all the effects of that medication. So the reason that the people in health authorities, the doctors, don't know that sciatica is actually a pinched nerve because they don't know how to unpinch it. They know how to drug it, shoot it, or send the person to physical therapy so they can get their muscles stretched or strengthened. But if that vertebrae is misaligned, causing some damage or literally a pinched nerve, okay, how do you unpinch it? Okay, they'll call it peripheral neuropathy. Okay, good. That's pinched nerve in Latin. So identify the problem with static and stress x-rays, and the stress x-rays will show if there is movement, and find a doctor that takes an x-ray, identifies the problem, and takes another x-ray to show the problem corrected. It is too good to be true if you're in a medical system where a doctor will take a symptom and give you a drug. Yeah, you're not going to fix this stuff with a drug. Question 4 from Douglas Charios. First, thank you for all you do, my friend. I'm following you for quite a while now. If a friend has an issue he needs help with, I usually get good information coming on here and typing your name and the condition. I've seen your previous videos regarding swing of the feet with weights. It works really good. Actually did research for a friend back then, and now I'm needing it. Paid for an MRI, did show the bone spurs, had some expensive orthotics made before the MRI based on a recommendation from my amazing masseuse. Doing therapy for 3 weeks now. Feel a bit better, but still can't do a leg day at the gym. Low weight squats still hurt. My big question is, sir, how do I get rid of the bone spurs? Is scrape job with surgery the only answer? Absolutely not. The bone spurs are there to stabilize an unstable segment. And just think of this. You've got 2 vertebrae that need motion to get nutrients to that disc because those vertebrae have a horrible blood supply. If you cut the torso off from here up, you're looking at probably more than 100 pounds a human spaced over the size of a 50-cent piece to a silver dollar. That's just as big as the disc is. And so blood vessels would be crushed. So those joints or those discs get their nutrients from position and motion. And if there's been a trauma, that alters the motion. Altering the motion causes the nutrients to the disc to get less, so the disc becomes shorter, making it unstable. And then the body, in its wisdom, increases the surface area between those two to stabilize it. So bone spurs are literally stabilizing the joint. And so this is going to be absolutely vital when you're looking at leg swinging, you're looking at poor foot biomechanics, you're looking at knee biomechanics, all of these things, those nerves come out of the low back. And knowing that your gait is going to be off, because if you have foot problems, knee problems, you're not going to be walking good. Well, half your ability to regenerate's located in that pelvis. So look at our pelvic health video number 1. Start sitting with a water bottle or a foam piece, foam roll, rolled up towel, whatever you can, 20 minutes in, 10 minutes out. Get to a good chiropractor, somebody that's going to take an x-ray of not just the lumbar and pelvis, but you've got to look at the thoracic area, the cervical spine. 30% of low back issues are coming from a misaligned cervical spine. So you have to look at the entire structure first, because if you're doing the leg dangling exercises, great. If you're doing the foot on a block stretch to stretch the calf, great. If you're working the intrinsic muscles of the foot, great. That's going to start to restore the arch and eliminate the bunion formation. But if you're doing all of those exercises without paying attention to the spinal structures, it's kind of like having a tourniquet on the nerves, okay, and then work in that tissue. There's no way I would put a tourniquet on my arm and go to the gym. So you've got to look at the structure and look at the list of x-rays. You can go to the drbvip.com site of the x-rays I would normally recommend for the standard patient. We can do some specialty x-rays too, based on the individual. But this way, we'd look at the entire structure first, look at our pelvic health video, start to stabilize that area. And then once you're restoring the nerve supply, then all the exercises will be way more effective. Then look at sleep patterns. So look at our sleep restriction videos. Look at the neurolinguistic programming and the visualization to reprogram that mind. And you're going to start to see really good results. And also look at Wolff's Law. Bones lay down where it's needed to resorb where it's not. So any doctor, any chiropractor that's doing pre and post x-rays will show you pre and post x-rays of bone spurs dysregenerated and bone spurs removed. I mean, it's the body is brilliant. It lays down the bone spurs to protect and stabilize, and it takes it up when the biomechanics have been corrected. Next question from Louise Everton. I'm coming in January. I hope you can help me avoid a hip replacement. I hope so too, darling. So the biggest thing with this is when you have a hip issue, you're going to have an altered gait issue. So, and the hip is supplied from L2, and that's right at the junction of the rib cage and low back. So to repair a hip, you have to first restore the nerve supply to the hip, correct all the biomechanics, heal the gut, restore the biomechanics of the feet, the knees, stabilize the pelvis, and then by correcting everything, the biomechanics of the feet, the knees, stabilizing the pelvis, healing the gut, changing the sleep patterns, looking at 3 things: physical, chemical, and emotional stress. You address those 3 things, then you have the best chance to regenerate. Then you create a distractive force on the hip. You create inflammation at the hip. You start to restore movement because that hip is going to remodel to the force loading on it. And then the hip can start to regenerate. So you got to correct all the original factors that caused the hip damage in the first place. And then you have the best chance to regenerate the hip. I look forward to seeing you. And one of the things too, with all the patients, I encourage them to record videos of a report, of the process, of everything, so that they can document it themselves. And there are literally thousands of videos out there on people's cell phones. I don't know if they post them or if they share them with friends and family, but film it when I see you in January. Now, if your question wasn't answered here, please go to the drbvip.com site. There we can answer more freely and without limiting answers that may have a controversial response to the environment. Boy, was that politically correct. God bless you all. Stay healthy, my friends. Your body gives symptoms for a reason. The planet was built for you, and you were built for the planet. God bless you all.